Ebola is spreading in Central Africa, and for this particular strain, there is no vaccine to fight it. The World Health Organization counts more than 50 confirmed cases and nearly 600 suspected cases. They say more than 130 people have died, and as a result, the strain is spreading in the DRC, or the Democratic Republic of the Congo, and the Uganda, and they believe it's been spreading for months. I am going to stop my...
We're several weeks behind. And when the virus takes 2 to 21 days, to incubate, what it means is people have already been exposed. So we're going to continue to see more cases before it can get under control.
Okay, my annoying watch has stopped. The WHO has declared a public health emergency. We want to learn more about this. It's so scary.
It is very scary. Our 9 News health expert, Dr. Payal Kohli, joining us now. Dr. Kohli, so experts are concerned that this outbreak is not contained. Is that true?
That is very true, Sam and Kim. And we're worried not just that it's not contained, but that it's been growing for some time and we didn't realize it. And so if you think about the incubation period of the virus, it's about 3 weeks. So we think for several weeks before they actually found the cases, the outbreak had been growing. And if you look at the test positivity, which tells us how many people we're screening and what percentage of them are coming back positive, you want that low around less than 10%. Some recent reports have been as high as 60%, which means it's actually probably growing faster than we even realize. And there's a lot of people out there who are even undiagnosed.
Oh, boy.
And the way we think this grows or grew, what happened in the earlier outbreaks in West Africa was during burial. Because some of the traditions in Africa, when you bury the corpse, is that you wash the body. And then other people can bathe in the same water, or you sleep next to the body for a few days, the corpse, before you actually bury it. And that, of course, can spread it. So you can even spread it after you die, because your body is still infectious even after you pass away.
Oh, so if a person dies, that's, yeah. So that explains some of it, how it's spread. But I'm going to ask you this. Are they prepared for this?
I don't think they realize how fast it's growing. And the fact that it doesn't have a vaccine and doesn't have a treatment makes us more nervous. What really makes us nervous is that the infrastructure in the Democratic Republic of Congo, which is hit by conflict, doesn't have the medical infrastructure to support this kind of spread. And there's migrants coming across the border from Uganda. We've already shown that it spread to Uganda. Certainly American workers, like the surgeon that was down there, have already contracted it. And we don't even know how it gets into humans, but our theory is it's possible exposure to bat meat or bat excrement. So if you have miners that go into caves, that's possibly, infected bat feces that potentially could infect you. So my concern is it's going to be very difficult to treat the people that are there and very difficult to contain it. And just to give you perspective in terms of mortality, earlier outbreaks, there's been a mortality of, 70% or some even as high as 90%. But if you take those same people and bring them to America, that mortality goes down to 20%.
Wow.
So a lot of that is about healthcare and infrastructure, and this particular strain has a mortality of about 30 to 50%.
This particular strain has a mortality about 30 to 50%, and that would be there. Okay.
And so if we can do better there, potentially we can reduce the mortality, but really there's no treatment. So how do you treat and get these people through this? They have profuse nausea, vomiting, diarrhea, bloody vomiting. They can have multi-organ failure. They can have shock. They can have electrolyte abnormalities.
Is it very painful? Can they treat the pain at least?
It can be painful, but so many times because you're so sick that you're even comatose. So you need an intensive care unit. You need medications to support blood pressure. You need ventilators. You need to get them through if they become infected, because the immune system collapses those infections. So it's really a supportive sort of care, which again, the system is not set up for.
So we do know of the one American, a doctor, who has tested positive, and you just explained how sometimes this is spread. How did he get sick?
It's so unfortunate. So his wife's also a doctor, and she actually treated the same patient, but he was treating a patient who they thought had a gallbladder infection.
Oh.
And he opened up the patient, and the gallbladder looked normal. So he closed the patient. The next day, the patient passed away, and it turns out that was one of the earlier part of the outbreak when they weren't sure that it was spreading so quickly. He's in the epicenter of the outbreak, and it was Ebola. So he has obviously contracted Ebola, and they say when they took him to Germany, he was so weak he couldn't even walk. So certainly our thoughts and prayers are with him and his family. He has little kids, and So I just hope that he is in a good environment right now where he can get that care.
I know, I've seen that picture of the
I know.
family. And they're doing this work
They're being
because of what they,
service.
yes.
Exactly. I know.
That's just-
Well, Dr. Coley, thank you.